Hi, I'm Dr. Bohn, and I'm going to show you what a muscle strain looks like. This picture depicts a partial tear or muscle strain occurring in this muscle tendon unit. This usually hurts, and so the person that has this stops their activity, stops exercise, and what you end up with is a healing process where the tendon became weaker. And now it's more of a setup for re-injury, maybe even worse than before. If instead you condition the muscle during the healing process and stay with activities and stay with a proper exercise program, what you end up with is a stronger tendon, more resistant to injury.
Let's look at a couple of common arm muscle strains. A rotator cuff muscle strain affects the shoulder and occurs in people who do a lot of repetitive stress activities or overhead work. Most exercise programs ignore the small muscles that make up the rotator cuff. Yet those muscles are at risk for a strain if they're not properly conditioned. Tennis elbow happens when there's a strain or tear in the outer muscles of the forearm and its tendon attachment at the outer elbow. In golfer's elbow, the strain occurs in the inner muscle group and its attachment at the inner elbow. These muscles require conditioning to ensure powerful and reliable lengthening contractions for many activities. Such conditioning benefits everything from overhead tennis serves to typing on a computer keyboard. Using light stretch bands, the Active Arm Exercise Program conditions these very muscles to perform everyday activities powerfully and comfortably without the risk of strain. Before you begin the Active Arm Exercise Program, please consult your doctor if you don't have a diagnosis for your arm pain. It's not unusual to have some discomfort in the target muscle groups when you do the exercises. Finally, if you're experiencing too much pain, stop the exercises and consult a doctor.